one of the indicators most associated with health promotion and well-being. It is also an important parameter related to the quality of life and the prevention of chronic diseases during aging. The decrease of this strength throughout life, despite being natural, can lead to a disease called sarcopenia, which is usually associated with the frailty syndrome. These conditions are very prevalent and problematic, especially in people of advanced age. People with frailty have greater difficulties in carrying out activities of daily living and in maintaining balance and agility. Their walk becomes more unstable, and this increases the risk of falling and bone fracture. The current pandemic has further increased the risk of developing these events, and it is very important to continually assess, know and monitor the physical condition of the elderly. It is estimated that in Europe, 60% of people at least 65 years old suffer from some level of frailty, and 25% from sarcopenia. More than 70% of this age group will suffer from sarcopenia by 2045. Several clinical trials have shown that physical exercise is effective not only to prevent the onset, but also to reduce the progression of frailty and sarcopenia in the elderly. Hi, my name is Daniel and I would like to introduce you to Gripwise, a project that puts science and technological innovation at the service of the population. Gripwise is a patented dynamometer consisting of an intelligent load cell. When combined with other accessories, this device makes it possible to assess and monitor the strength of different muscle groups. Because it is lighter and smaller than other existing solutions, this device is easily handled by frail people. But how does Gripwise work? This smart device allows you to collect tensile and compression strength data. Gripwise communicates via Bluetooth with mobile devices, both iOS and Android, which in turn aggregate this and other data to be transferred to a cloud platform. With Gripwise, it is possible in less than 5 minutes to assess the level of frailty in the elderly according to Fried's phenotype. Through a simple and fluid workflow, this process can be performed by less qualified professionals. In addition, data can be collected on a cloud platform, where the strength data and the strength profile of Gripwise users are analyzed automatically. Health professionals can assess the information and, using validated scientific processes, it is possible to diagnose people with sarcopenia. With this, health professionals are able to be faster, more effective, and they are ready to remotely monitor people in vulnerable situations more accurately. For these cases, professionals can prescribe personalized follow-up programs with physical exercise and nutrition where the use of Gripwise is essential. Gripwise is a unique project because the evaluation of muscle strength is done remotely and by any health professional. Money and time expenditures are reduced as the user does not need to travel to the hospital or health clinic. With the anticipation of diagnosis of frailty, the health professional can also recommend and monitor personalized nutrition and physical activity programs for the most vulnerable. These programs can maintain for a longer period of time the strength and quality of life of the elderly. Our priority is to get this solution to people who live in nursing homes or who have home care. And how can we enhance the use of Gripwise? The articulation of this solution with gamification techniques can increase the user's motivation, their training, and their involvement. And in the context of health, the so-called exergames promote the user's movement and have produced frankly encouraging results. It was thinking about the need for an immersive and movement-based experience that the video game Living in the Countryside was created. Through an emotional narrative and an attractive design, the user embarks on the adventure of having to maintain a rural farm. Painting fences or feeding the chickens are all part of the daily activities of this farm, and all of these tasks are carried out with the support of Gripwise. In the activity we see in the image, Alice uses the hand grip to milk a cow. To complete this task, the user has to fill several buckets of milk using one hand at a time. With this and other tasks, Alice fulfills her daily plan for muscle strengthening in a simple and fun way. The game was designed to be adjusted to the physical condition of users, since each task is calibrated using the maximum strength of the user at that moment. The game receives feedback on the effort required to complete each task. And on a daily basis, it also allows the user to record pain, adjusting exercise plans so that muscle groups in pain are requested with less intensity or less used. The data collected by users' mobile devices can be consulted remotely by health professionals. This allows permanent monitoring and evaluation of the quantity and quality of exercise or physical activity performed. These professionals will also be able to adjust the physical exercise and rehabilitation programs, defining the number of sets and daily repetitions that the user must do with Gripwise. These plans will then be automatically incorporated into the video game. The project has been developed to be a powerful tool to monitor the evolution of COVID-19 patients, allowing an assessment of their physical condition while confined. Our solution is also ready to be used in different age groups and occupations, as well as in the recovery of various diseases. We are at the forefront of quality of life. Join us. Gripwise. Get a grip. Be wise.